Hi, everyone. We're here talking postpartum period care. So, would love to answer any questions folks have about postpartum care. And we are going to go over kind of best practices, maybe common questions that we see here at Saalt. My name's Bridget. I work on the customer experience team, and all day long we coach people on their periods, or for this case, maybe a time when you don't have periods. So we coach people on different reusable solutions, seeing what's best for your body, providing some different options, and would love to answer any individual questions people may have. But kind of starting out, I guess, the why on why we're talking about postpartum care. Um, as we know, periods happen from adolescence all the way to menopause. And then there's a big chunk of your life, if you're having kids, that you may not have a period. But periods do change after actually they change quite a bit kind of in the lead up to getting pregnant and after getting pregnant. So a lot of times people have kind of a go-to reusable period care solution that works for them. They get pregnant, maybe they have a kid, and when they go back to use what the product they used before, it no longer works. So a lot of the questions we answer on the customer experience side tend to be around what's best for pregnancy or postpartum, and would love to talk through a few different options. So there's also a lot of myths around this category. So sometimes if you go deep down an internet rabbit hole, there'll be all these crazy things out there about what to use, what not to use postpartum. So we'll try to talk through some of the more science-based facts around postpartum period care. But essentially, we have a ton of options, anything from discs, which are very popular as a postpartum option, all the way to underwear. This is our Saltwear. It's our leak-proof underwear. And so essentially, we have products designed for anything from pre-pregnancy, throughout pregnancy, when you have experienced different leaks, and then also postpartum. So walk through a few different options. If you have questions, drop them in the chat. I'll try to keep an eye on that to make sure I'm not missing anything. And we can go from there and do some demos. So as you know, everyone's body is unique. Everyone's postpartum journey is unique. So I'll just kind of go some general overviews. But let's start with pregnancy. So your body's going to undergo a lot of changes if you're pregnant or planning to get pregnant. One of the main questions we get asked is people are like, if I don't have a period, why would I need period care while pregnant? Well, you have a lot more leaks and kind of a lot of changes with fluids during that time of your life. So in the second trimester and third, you may just want a little bit more protection. You may not be having a period, but you are going to have more discharge. You may experience some bladder leaks, especially kind of that later stage throughout pregnancy. There's a lot of pressure on your bladder. And so it's really common. You kind of hear that like common joke about sneeze, peas, and all that. Period care, especially Saltwear, is really comfortable for that time period because you're going to have that built-in protection. So just like you would a traditional pad, you see the absorbent liner here. This is called a gusset. This is really what's going to help protect you from those light bladder leaks throughout pregnancy. It's also for discharge and kind of daily sweat and wear. One of the reasons I'm holding this is called our seamless collection. One of the reasons I'm holding this fabric specifically, not only is it lightweight, but it also stretches up to 4 times its size. And so with a growing kind of midsection, this is a really forgiving style for pregnancy. We have it in a thong, brief, and high-rise option. So depending on what's most comfortable for you, sometimes I prefer the high-rise for our pregnant folks out there because lower rise can kind of fold down and unfold. And I don't know about you all, but when I was pregnant, I just didn't like any extra pressure on my midsection. It was already more sensitive around the middle area, and kind of a growing, these are the best kind of styles to accommodate a growing belly. So one of the beauties too is if you kind of get used to wearing period underwear and can give it a try during pregnancy, postpartum, you are definitely going to want a few options for absorbency. So I wish I had them here, but the hospital is going to give you kind of an adult diaper. It's usually a mesh underwear that is really designed to absorb postpartum fluids. So After postpartum, very common to have a lot of heavy bleeding, maybe some amniotic fluid that's still releasing, and just generally, it's a time of many fluids. Um, I would highly recommend period underwear for this time period. You can also double down and do pads plus period underwear for those first couple hours and first couple days if you want just the most absorbency possible. But really, during this time period, you're just going to want something for protection and absorption. So we have a few options. The seamless is nice if you have a C-section or you just kind of have a more sensitive area, maybe had some tearing or other issues that came out during that delivery period. The seamless has, as it's called, no seams. It's not going to rub or irritate kind of the more sensitive areas. I would suggest a higher absorbency or super absorbency. So um, that is a great go-to option for anyone who knows postpartum. If you have questions, let us know. Drop them in the chat. They don't have to be pregnancy or postpartum related, but would love to answer questions in real time for anyone. The other option that I would suggest for a great pregnancy and postpartum is our boy short. So this is a little bit different fabric. This is our comfort fabric, which is actually a really soft modal. The reason why I'd suggest the boy short is it actually has a little bit wider gusset and it has a little bit more coverage front to back. And so just in terms of ultimate absorption, the boy short's going to give you a little bit more than that brief style. It does have that full coverage, so a little bit more too in terms of just protection. Everyone's body shape is so different and every pregnancy is unique. So sometimes people are like, how do I know what size and style is going to work for me? I suggest getting a few different just to see what's more comfortable. And sometimes as you're carrying, your belly can kind of change shapes and sizes too. So what's most comfortable one day may not be the most comfortable for the next day. Postpartum, what a common question is, how many pairs do I need and how much do these absorb? You will need to change your pairs quite often in that first 24 hours or first 48 hours. Most people are going to have experienced some pretty heavy bleeding during those days. And you kind of, everyone's pregnancy is unique. So it really depends on what you're most comfortable with. People talk, I think sometimes people are scared of reusable period underwear just because they have to do more laundry. Honestly, as a mom of two, those first couple days you're doing a lot of laundry anyway. Maybe not you, hopefully someone helping you, but with newborn clothes, so no big deal. Just to wash your saltware, you're going to want to rinse with cold water. I like to kind of fill my sink up, rinse until it runs clear, and really then throw them in the wash with any other laundry. We do have a mesh laundry bag if that's something you're interested in. Let me grab that. So you can throw this in with your regular laundry and then hang dry. So to have enough pairs for those first couple days postpartum, you're definitely going to want to invest in a set, or you want to start kind of with a pad plus your saltware. And then as your spotting and bleeding goes down over the course of that first week postpartum, you probably can go back to a more normal cadence where you wear maybe change them 2 to 3 times a day. So depends on absorption level, but if you're going to be planning to wear a saltwear for postpartum, I highly recommend our super absorbency or heavy. So boy short comes in super, and then you do have some heavy absorbency options in that seamless collection. Here's kind of another common topic we get is, what do I do once my period returns, and is my postpartum period normal? So a lot of misconceptions around postpartum periods. There's a lot of myths out there too. A lot of people think that you can't get a period if you're breastfeeding. That's actually not true. Like, you can have a period while breastfeeding. Sometimes it's kind of a mean surprise. People are like, I'm doing all this work with a newborn and I have my period back and this and that. It's mean. Sometimes being a postpartum mom is just kind of rude. But for inserted products, the general rule of thumb, and always consult your doctor for kind of what how your pregnancy and birthing experience was. The general rule of thumb is no inserted products for 6 weeks. Again, could be different if this is your first kid versus fourth. Could be different depending on, did you have any tearing? Do you have any scar tissue? Um, have you seen a pelvic floor therapist? Have they cleared you to go back to normal activities? Everyone's going to be unique. Age and just pregnancy and birthing experience is really going to play a big part of it. So just because maybe your best friend or sister said that they could use inserted products right away, I would always consult with your own medical provider on what would be best for you. My recommendation as a Saalt coach here is always for postpartum periods. I just love the disc as a go-to option, and there's a few reasons for that. First is from capacity standpoint. So unfortunately, if you're new to the postpartum period or you're expecting your first period postpartum, you are going to be in for a surprise. Your cycle may have been really predictable and stable. It's going to be all out. It could be all out of whack when you come back the first time it comes back. So your body's going to take a while to regulate those hormones and get your cycle kind of back to its normal cadence. Sometimes people's pregnancies change their cycle kind of for the course of their lifetime. It's a little bit wild, but everyone's experience is unique. And the disc is just a great option for more capacity. So this holds 50 milliliters of fluid versus 30 milliliters with our regular cup. So from a capacity option, I do like the regular disc as a great place to start for a postpartum period, because you kind of have to see how heavy those flows are once they come back. The other tip for the disc is it sits higher in the vaginal fornix versus the vaginal canal. So let me grab my model really quick so I can go over that. But essentially, if you're a cup user, you're very familiar. Your cup is going to sit in the vaginal canal. So you insert it a little bit lower. You're going to fold it and wait till it opens up kind of in that vaginal canal. In our anatomy model, the tail's sticking out, but essentially it will be inserted fully into your body. The disc, however, it's going to fit underneath your cervix here. So it fits up in this wider portion called the vaginal fornix. Why that is important for postpartum is your pelvic floor has done a lot of work growing, carrying, birthing that baby, and it is very common for people to experience some pelvic floor dysfunction post birth. So there's like an old adage of your body just snapping back to pregnancy. Well, your body has changed. A lot of your anatomy has changed while you carried a baby and gave birth. So it's very common for people to try to go back to their previous cup and experience that cup either slipping or falling or migrating once it's inserted. That's a super common issue. And essentially, a lot of that could be caused by just your pelvic floor not holding that cup in place, or it could be a sizing issue, and maybe your vaginal canal changed shape and structure during that pregnancy or delivery, and your old product is just not the right fit for you anymore. Why the disc is a little bit more forgiving is essentially to insert the disc, I'm going to fold it and then insert it into my vaginal canal, just like the cup. But instead of stopping there, I'm going to push it all the way up and tuck it behind the pubic bone. The disc is actually being held in place by this pubic bone. So it's not being held in place by the suction in the vaginal canal. So it's a little bit more forgiving for those kind of healing bodies postpartum. And also, like I talked about before, you're just going to get a little bit more capacity. So if you're itching to go back to a inserted product postpartum, highly recommend the disc as an option. The other recommendation, and this is more, I guess, personal versus professional, I would have is sometimes you can just experience a lot of discomfort with inserted products. There's a lot of healing. Your body did hard work. I am now 5 years postpartum. I have 2 young kids, and my first periods were very painful to have inserted products. I'd highly recommend using a water-based lube or just getting your disc wet for insertion. It may feel like some pressure and discomfort the first time you insert anything into your body postpartum. Take it slow. If you have the ability to see a pelvic floor therapist, if that's in your kind of recovery roadmap, highly recommend it. They're amazing. They can basically do an internal exam. They can take a look to make sure everything's healing correctly. I think a lot of times in our postpartum care, that's kind of skipped over, but these professionals are extremely helpful for that. So, would love to answer any other postpartum questions you have. Hopefully, you got a great overview. If you have any questions at all on kind of Saalt cup disc, I'll be on for a minute or two answering more questions. So drop them in the chat. Let me know what you want to learn about. I do have kind of all the styles of period underwear or saltwear if you're interested in that. We also have a few bundles on our bundle page, and essentially those are just kind of starter kits. So if you're new, have a pregnant friend, I always say the best gift you can give to someone on the registry, don't give them a onesie, give them a pair of saltwear or a few. I've done this for family members and friends, and it's funny. They're like, that was the best pregnancy gift I ever got. Something I actually use and can really help me as a mom. So, highly recommend gifting saltwear. We have a great kind of team of coaches. If you have questions, if you're concerned about sizing, the other final tip I'll leave you with is for pregnancy sizing. I'd always recommend you match your kind of regular underwear size. And if you're going with seamless, it's going to stretch with you. So don't worry about sizing up. What I would do is if you're medium in underwear and you're getting maternity pants in medium or shorts or whatever kind of bottom you have, go with that same sizing in the seamless underwear, and that's going to stretch with you. If you're going to a little bit more structured fabric like the Comfort or the Con collection, if you've jumped up sizes during your pregnancy, maybe size up in those collections just because they don't have quite as much stretch as that seamless. But I do think our Comfort collection and Boy Short do have good kind of forgiving stretch. So I tend to size people down. I don't worry about kind of bumping them up so they get so much fabric. I'd rather have something that people can use for their pregnancy and postpartum and beyond. So hopefully you learned a few things. If you are a postpartum mom struggling with your cup, your disc, your period care in general, send us a message at sayhey@saalt.com. We would love to troubleshoot with you. We'll get you taken care of, get you something that will work for your anatomy. And one final plug for seeing a pelvic floor therapist. If that's in your path and you've kind of been on the fence about it, we talk to them kind of monthly here at Saalt and cannot recommend them highly enough. Find someone that's going to help you with your recovery roadmap and really help guide you through that postpartum period. So thanks so much for watching. Hopefully you learned something.